Why does the side of your hip hurt when you're sleeping at nighttime? Hello, this is Dr. Siddharth Dambar, expert in rheumatology and in regenerative medicine. A really common complaint that many people have is that they have pain at nighttime when they're sleeping on one side or the other. So to figure out what's causing this, there's a couple things that you need to do. The first is you need to differentiate between pain that's on the side of the hip or lateral hip versus pain that's in the front of the hip. So pain that's in the front of the hip is more classically coming from the hip joint, the labrum, or the hip flexor tendon. Sometimes that can also cause pain on the side of the hip when you're sleeping at nighttime, but normally that presents a little bit differently. So pain on the side of the hip, there's a few really classic things that can cause that. One of the top ones is if you've got an issue in the SI joint or in the SI ligaments. So the SI joint, the sacroiliac joint, is the large joint in the back of the hip that connects the pelvis to the hip. So very key, it's a very key stabilizing joint as well. If you've got pain in that joint, you can have not only pain in the lower back, in the back of the hip, the side of the hip, even down the leg as well. You can also have SI joint ligament strains or laxity. That's very common. If you've had a strain in the lower back, frequently that is actually affecting the SI ligaments. If you've had an injury from, let's say, a sport or you're doing a chronic activity, that can cause that. In addition, very commonly in mothers, after they've given birth, the SI ligaments are left relatively loose and unstable long term, which will then cause a lot of this sort of pains along the side of the left or along the side of the hip. Another common cause for pains on the side of the hip would include tendinitis or bursitis. So the gluteus medius, gluteus minimus tendons insert on the side of the hip. So on the side of the hip, you have a bone called the greater trochanter. It's the one that you can palpate and actually feel on yourself. And frequently that will feel tender at night because you've got tendinitis on that side. If you've got a bit of weakness in the hip muscles, the tendons end up getting overstrained, which can then cause tendinitis on that side. Putting direct contact against those tendons can cause that kind of pain. There's also a bursa on that side. The bursa is a small fluid sac along the side of the bone to help protect the bone. If that gets irritated, that can also cause pains on the side of the hip. So you can get bursitis if you have, let's say, direct irritation or trauma to that bursa, but also if the tendons just above the bursa get irritated for whatever reason, that can also exacerbate the bursitis as well. Another common cause, if you've got chronic lower back pain or arthritis of the lower back, is that if you have a pinched nerve at the L3 or L4 level, getting pains along the side of the hip can occur as well. Other soft tissue structures can also be irritated. That includes the muscles like the piriformis muscle, or if you've got a strain of one of the hip ligaments on the side of the hip, that can also cause pains on the side. So how do you figure out what's actually causing that pain? Well, number one, where is the pain? Again, is it in the front of the hip or more in the side of the hip? If it's more in the side of the hip, some of those issues that we discussed are likely at play. If you've got more back pain that also gets expressed as the side of the hip, that may also help lead you down one path as well. Examination by a physician is very key. How does your hip move on range of motion? Do you have any tenderness on exam? Do you have any other issues or neurologic findings as well? That's a really key way as a physician that we can help figure out where and what is causing your pain. And then lastly, you may need some imaging. Let's say x-rays if you want to look at the bones, an MRI if you want to look at the soft tissue structures such as tendons, ligaments, or if you need to look for a pinched nerve in the lower back. Treatment really depends on what the cause is. Treat the cause of the problem, right? So depending on what your issue is, that would direct how you want to actually treat this. But some common things that most people should be doing if you've got this kind of side of the hip pain when you're sleeping at night would include, number one, doing a lot of core and hip strengthening exercises. Strengthen the core, strengthen the hips, makes a big difference. This, for most people, that sort of pain is due to instability. And for example, if you have a ligament or a tendon that's been chronically injured, if you've got instability in the SI joint, then if you position yourself when you're sleeping at night, where you now have your full body weight now pressing up against that instability, that'll then exacerbate any of the kind of pain that comes from that instability. Core and hip strengthening is important because you strengthen the muscles around that area of instability, which will then help take pressure off of those kind of structures. And then lastly, if the conservative options are not helping, then you consider a treatment such as prolotherapy or platelet-rich plasma, where utilizing regenerative medicine, we're now trying to strengthen the areas of instability and weakness to help not only treat your instability, but also your pain that you're experiencing at nighttime. If you found this video and content to be helpful, please give us a like, subscribe to the channel, and until we meet again, have a good day and live well. Bye-bye.